Hello and welcome to our viewers. I'm Nicole Thomas, and today we are going to hear from SailPoint customer Andrew Greenspan. He's the Senior Director of Identity and Access Management at New York Health and Hospitals. New York Health and Hospitals is the largest public healthcare system in the United States. Andrew, thank you for joining us today.
My pleasure.
First question for you, Andrew. Can you tell me a little bit about your background and what you do for New York Health and Hospitals?
Sure. I have 30 plus years of IT experience, with the last 15 in identity and access management, and have spent the last 9 years at New York City Health and Hospitals, running their identity and access management practice from its infancy to where it is now.
Can you tell me a little bit about that journey so far?
Sure. It started with 2 incumbent identity access management products that were in-house that I evaluated and identified that we needed to go out. In 2015, we did an RFP and did a review process. We included a few other vendors and SailPoint won that RFP process. And in late 2015 into 2016, we implemented SailPoint in our initial deployment with Active Directory and a couple of applications. And then just to recap, over the last 4.5 years, we've expanded the use of IdentityIQ and included, we've moved to Epic. So we've included the Epic connector into that. And we're moving towards a couple of new areas in that journey.
How has your identity program adapted as of lately?
Well, here's the good thing. It did not have to adapt because it was able to meet the need. Between March 2020 and the end of April, we onboarded 10,000 people to support the extra activities of COVID-19, to support all our hospitals, which we have 11 hospitals and over 100 clinics. And that didn't budge anything on IdentityIQ. We were able to onboard those people. And just to bring that into perspective, in 2019, we only onboarded 6,500 people over a year. And this was over a 6-week period. So it didn't phase the IdentityIQ system. We were able to handle the load without any problems.
What would you say has been the biggest win for your team's identity efforts?
I would say there's a couple. One of them is consolidation. When I took this responsibility on, there were 11 different provisioning processes, onboarding, offboarding processes around the 11 different hospitals. And we consolidated all that into one automated process, so that it went from provisioning a user in days to provisioning a user in hours. So, and the hours, because we, with our authoritative source, which is PeopleSoft, we have an hourly feed from them. So it takes an hour to get something done. So that's the first piece of it. The second piece, which is very important, is our beginning our interface with Epic, as I stated before, so that we automated that process for their EMP records. And we are now working on their SCR records, which is the service provider records. So that's another win. And then the third one is working with, which we are just launching now, a full interface with ServiceNow, so that a request out of ServiceNow will automatically flow into IdentityIQ. We'll then do automated processes to provision those requests, and then send the response back to ServiceNow saying it's completed. So we're trying to remove hands getting in the way of automated processes.
What advice do you have for other healthcare organizations that are just beginning their identity program?
My biggest idea in this one is very simply, pick a path. My path was lifecycle management. I had to make sure that provisioning, deprovisioning processes were solid for every location, and they weren't done any differently at any of the locations, so that we could get that automated process. Some people look at governance, knowing what people have access to and being able to remediate that. But don't go down both paths at once. Pick one and finish it, then go to the next.
What's on the horizon for identity at New York Health and Hospitals?
More automation. Like I said, this interface that with between SailPoint and ServiceNow, we're going to take full advantage of that and start doing things that make sure that when a request goes in, within minutes, that request can be satisfied, be that adding a new application to a user or getting them deprovisioned, emergency deprovisioning, because as we know, things happen before our HR system can react. So we have to have a way of doing a remediation for emergency situations. And those things will be handled in an automated fashion. The last thing that we're looking at, again, which would be the Epic SIR record, to automate that as much as possible and interface with our credentialing system.
Fantastic. Last question for you. If identity was a celebrity, TV, or movie character, who would it be?
So this one's pretty good. I was thinking about this a while back. I come up with Thor. And the reason why I think of Thor is because of the power in the hammer, as you bring down the hammer and you make things occur. So that hammer coming down, earth shatters. In the way of IdentityIQ, it is changing mindset, or as I say it, agent of change. And that's what IdentityIQ is. It's an agent of change to automation.
It has been a pleasure talking to you, Andrew, and learning more about New York Health and Hospitals' identity journey. We're excited to see what you and the team accomplish next.
Thank you. It's been a pleasure.